Hey everyone, welcome back to Bionexus podcast series, Autism Uprooted. I'm Dr. Jodie A, Dashore, as you all know. Today we have a unique opportunity. You guys may remember that we spoke with an amazing mom from Serbia, right, Alexandra, and she has taken the initiative to encourage other mothers in the Eastern European countries. And, she has a fantastic group. The entire group is here today, absolutely dynamic moms. And we will be having a spirited discussion about how to heal our children with autism spectrum disorder. So without further ado, I will give the floor to Alexandra.
Welcome to the Bionexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of Bionexus Health Podcast, Dr. Jodie A. Dashore.
Thank you so much, Dr. Dashore, for making this podcast for us, for our group. We are a group of moms that know each other for some time, from some Facebook groups, but then we also established a formal association, which name is Children Without Limits, and which is a regional association which aim is to promote and to raise the awareness about the medical treatments for autism. And this podcast will be one of the activities for our association, and we think it will be a very important one because we are very much interested in the root causes of autism, especially Lyme disease, co-infections, biotoxin, illness, mold, and so on. Mm-hmm. So thank you very much. This is really a great opportunity for us to discuss these questions with you.
Oh, absolutely. I'm happy to be here. Early I said hello to a few, but there's a lot more I just realized. So there's Jana, there's Ivan is Mr. Alexandra, I guess.
Yes.
Okay. Yep. So I see there is Ladija, there is Tijana, Vesna. Oh, there's such a wonderful group of moms. There is Mayarmomik. I'm sorry, I'm saying it, well, I'm sorry about the mispronunciation, but a big hello to everybody from my side. Happy Sunday morning for me. And it must be afternoon for you guys, right?
Yeah, it's afternoon. It's 2 o'clock.
2 o'clock.
But it's a good time, yeah.
Okay. Well, I hope nobody will fall asleep after having a heavy lunch.
Yes.
All right. So from what I understand, you have, I'm happy to answer questions. From what I understand, you moms have questions for me.
Yes, exactly. We have prepared some questions, and maybe I can start with the questions, and I don't know if other moms want also, but we have prepared a list, so maybe I can be a mediator for the podcast, and then if anybody else wants to add something, and of course everybody's welcome to ask questions. So we just have more people coming in.
That's
Sorry
good.
about this.
Yes.
But then let me start. The first question we wanted to ask you: in your clinical practice, how many patients with autism spectrum disorder have Lyme disease and co-infections? Because this is something a common questions for us, that we wonder, does my child have a Lyme disease and co-infections? And we know that of course you need to do the testing for this, but it seems to be very common in the kids with autism spectrum disorder.
Correct. In my practice, I would say 99%. I can count on my fingertips how many did not have Lyme disease. Now, one thing to understand is that Lyme disease is a clinical diagnosis. Okay, when you go on the US CDC website, even there you will see, in spite of all of the controversy surrounding Lyme disease, it is stated and acknowledged by the CDC as well that it's a very complex disease. There are co-infections, And lab testing is often inaccurate. And there are many reasons for that. One of the main reasons for that is there are many immune suppressing mechanisms that are demonstrated by the borreliosis bacterium, right? So the CDC states that it is best to proceed with a clinical diagnosis if your practitioner, obviously you need a proper, ILADS or a properly trained and experienced practitioner to be able to make a clinical diagnosis. So if there are symptoms, so it is best to start treating. Considering all of this, about 99% of my patients on the spectrum that I see have Lyme disease and co-infections. And, it may very well be that the other children, like I said, there's just been a few over the last decade, more than 10 years. And these are either, truly autistic, they're happy being autistic. They are, there's no behaviors, there's no picky eating, they're happy, they are growing, except that, they are your textbook autistic children, right? And there are others who are on the spectrum, but they are enormous athletes. So they are athletic. Now, being very athletic, your immune system is able to handle a whole lot more than children, who are not athletic. So that could be the reason why. But yeah, easily 99%.
Wow, this is really kind of, not to say amazing, but a bit shocking that so many kids, because you would not expect that. I mean, we don't have people here who are specialists in Lyme disease, and rarely anybody would be suspicious that a kid has Lyme disease. So, this is for us, it's really important to understand that the testing for Lyme disease, as you say, also the clinical picture should be taken into account. So, yeah. Okay, so the next question would be, how you said that the clinical presentation, would you recommend any tests that could be used for Lyme disease? I remember. Now I'm sorry, because we have
that happens. Moms,
yeah, let me just try to do something to mute everybody, but I'm not sure. Yeah, I think we are okay now. Is there any testing? And you have mentioned once that even from organic acid test, you can find some indications for Lyme disease. Is this something that you would recommend people looking at, or you think that it's really best just to look at the clinical picture, because, as you say, that the immune system is suppressed?
Correct. See, testing and treating go hand in hand, right? I would say testing, treating, and diagnosis goes hand in hand. So having an experienced practitioner in your corner is quite important. If you are attempting to do it yourself, then ilads.org has good information, actually better than that, LymeDisease.org, right? It's easier to remember. So LymeDisease.org is a really good website which gives a list of symptoms for Lyme disease and co-infections. Now, here's the hard part. Many of the symptoms appear to be symptoms of autism. So without an experienced practitioner, it becomes difficult, to diagnose. Now, there are many tests out there that are available. Now, organic acids test, you have to interpret that as a whole, right? Now, just looking at Lyme disease doesn't seem to help without looking at the big picture of biotoxin illness, because biological toxins are produced by Lyme disease bacteria. It's co-infections, right? So combine that with environmental toxins. So I feel that, whatever you may want to do, if you want to do hygienics or Armin labs or organic acids, or, try and diagnose yourself, I really feel that having a practitioner at your side who is experienced is quite important. Additionally, the one other thing that comes to mind is herbal medicine. You know, people think, oh, it's just herbal medicine, you know, it's all plant-based, natural. But remember, it's not advisable to do a do-it-yourself, because herbs are pretty powerful. So, you know, there can be die-off reactions. You have to decide the dosage based on the child's height, weight, symptoms. You have to decide the order of treatment. In fact, if you guys want to tune in to my Autism One lecture this year, the Autism One conference is in Phoenix this year, Phoenix, Mesa, Arizona, in the US. And I have two lectures. One, I'll be speaking about pregnancy and mold, right? Pregnancy, mold, and autism connection. And the second will be, what is the correct order of treatment? So for those of you, you know, who want to know more about this, have a look at my lectures. You know, autism1.org has the schedule published as well.
Okay, great. Excellent. Excellent. Thank you very much for telling us this, because, you know, we are a group of moms who is also very eager to learn. And as you say, we need to have an experienced practitioner. But as you always say, we need to also follow our own instincts. And the more we know, we better follow the instinct also to find the right practitioner for us. And
absolutely.
Yeah.
Yes. Yes.
Yeah.
Following instincts. Yes, because following instincts is great. But, you know, Lyme disease and biotoxin illness are pretty serious illnesses, right? You know, they affect multiple organ systems in the body, and knowing what to treat, what kind of support to give, you know, each child. I mean, I've got like several twins in my practice. I even have triplets in my practice, and everyone has their own customized protocol. That is the key, because autism, first of all, you're told that, hey, you know, there's no cure. Okay. And when you start digging deeper and you find all of these medical issues, which can further complicate the autism presentation, or that may very well be the cause of the autistic presentation. You know, that was the case with my son, with my Brian. Because, you know, like 80% of the autism symptoms were because of underlying issues, you know, once again, like I said, the big umbrella of biotoxin illness. But, you know, and only 20% were like, you know, some autoimmune genetic issues that we had on my husband's side. So those kind of kicked into gear as well. But other than that, you know, he is, I would say, 95% recovered right now. Nobody recovers 100%. That's just, you know, something that you should understand. You know, there's no cure for autism, but a lot of recovery is, you know, certainly possible. For us, what happened was Lyme disease had already attacked for many years. You know, I didn't know it. I had passed Lyme disease to my son in utero. So Lyme disease affects multiple organ systems. So over the years, you know, before around 6.5 years of age, when he collapsed, you know, he went into paralysis, he was in a wheelchair, excruciating pain. So Lyme disease had already damaged the bone marrow. It had damaged the joints, you know, it had damaged the growth hormone secretion in the brain. So this damage was done. So all that we have been able to do about that is prevent further damage. Okay, so that is why 95%, right? Because, you know, he still has physical disabilities, but we manage, you know, overall we are functional. Like he has neck problems, back issues, growth issues, but overall he is fully functional, you know, by God's grace. So that's what we have been able to achieve so far. So it's a pretty hard journey to undertake.
Absolutely, absolutely. And we have seen podcasts with your son, and he's really amazing. You know, if I feel if my son could be this 90, 90%, 85%, I would be happy, because your son is now on the medical school, and he seems to have good friends, and like leading a typical life, and this is really an amazing achievement, and you are an inspiration also to us other moms, and thank you for doing this work. Yeah. This is great. And I think maybe just one more question about the Lyme disease. You already mentioned that you have passed on the Lyme disease to your child, because many of us do not recall, that our child was bitten by, that it had this bite. Could you please explain more? So it is obviously possible to transmit in utero, and also by tick bite, and also by it can be a mosquito, it can be it is quite actually broad spectrum of bites. That's why it's called tick bite, because we don't remember that it has this kind of inflamed circle,
a bullseye rash,
and so on. So that's why we are a bit confused. If we knew that we had this bite, then I think we would believe more. But it seems that Lyme disease is quite common, and just that expression in each individual is different.
That is correct. Yes.
Yeah. And is it possible? We had a question that father transmits Lyme. This is not possible. Can a father somehow transmit? This is probably not possible.
Oh, yes, of course. No, of course.
Yeah. Okay.
Because yes, one of my pet peeves is that the mom gets blamed for everything. It's in many cultures, and if nobody else blames us, then we blame ourselves. Now, what did I do wrong? And it's there's a lot of guilt and depression and anxiety, which us autism moms, unfortunately, we tend to do it to ourselves, and then often extended family members, even immediate family members, will end up blaming us as well. I've had mothers with like minor issues. Well, I had gestational diabetes, and I'm like, relax, breathe. It wasn't your fault. Another one had some kind of a strep infection somewhere during pregnancy. She did antibiotics. That's completely fine. But yes, Lyme disease and co-infections are sexually transmitted as well. Okay, so it can be sexually transmitted. It can be from father to mom, and then mom to child.
Okay. Thanks very much for this explanation. Yeah, this is kind of eye-opening. We have Gordana who raised hand. So maybe Gordana can ask a question, if I understood correctly. Yeah?
Yes.
Hi, Gordana.
Hi, hello. I wanted to ask, is there always a rash in a child when he has Lyme infection, or?
No, no, maybe 15 to 20% of the time of cases that you will actually see a bullseye rash. I myself did not see anything. What happens is also another perspective to keep in mind is when the child gets Lyme disease from mom, first of all, no, there obviously isn't any rash because it came from mom. Okay. Now, because the Lyme disease bacteria came from mom, the child's immune system thinks, oh, it's from mom. It's fine. It's friendly. Okay. So should the child acquire insect bites that carry Lyme disease again, what will the immune system do? Nothing. Because the immune system thinks it's friendly. And then the new Lyme disease and co-infections, nobody gets just Lyme, everyone gets co-infections. So they will start to do their number on the immune system. You start to see that the immune system gets suppressed. You have a child, you will see a child, who never gets fevers. You will see a child who becomes overweight. You will see many typical symptoms of autism develop. And some of the first symptoms that are seen if it is in utero transfer of Lyme, some of the first symptoms you will see is a severe colic and a lot of GI issues, a lot of GI. You have the child who is not able to latch on because low muscle tone, right? Even if the mom wants to breastfeed, it becomes very difficult because there's low muscle tone. The child is not able to suck and swallow, again, because of low muscle tone. You will see delayed milestones, not severely delayed, slightly delayed. You will see that the child doesn't have, really good gross motor and fine motor skills. Again, low muscle tone. You will see constipation. Just remember, there are smooth muscles inside your gut. So when there's Lyme disease is in the picture, the low muscle tone affects all kinds of muscles, not just your skeletal muscles, also the smooth muscles inside. It affects the heart. Heart is a muscle. So there are numerous complications, but there are several early signs. For my son, we had a weird thing that showed up in his heart. It was some kind of signal which they were getting at during the advanced ultrasound. So that was very scary, right? We were given genetic counseling. There was a lot of hoopla made about it. After birth, for 3 months, we had to monitor him. But overall cardiac issue, there wasn't any. He did get a cyst in his kidney, a small benign cyst, but so far so good. I've been handling it with kidney friendly herbals and what have you. But yes, severe colic. Thankfully, he was able to do some nursing. And then after that, lots of GI issues.
Yeah, okay, thank you very much for telling us this. And when it comes from your own story, then I recall how my son had severe colic issues and GI issues. It really rings a bell that something seriously had gone wrong from the very start, and we do not understand, why is that. Okay, maybe now just one question that we had was, when you understand that the child has a Lyme disease, is it very common that co-infections are present? Co-infections like Bartonella, Babesia, and so on. Is this something that you also see in your practice, and you start treating all of them because it's a common event that they all go hand in hand?
Absolutely. Everyone gets co-infections. Just which ones? That has been studied, actually, right? So there are a couple studies that have been done, and what has been discovered, and these are like pretty heavy-duty doctors. Some of them are my mentors as well with Lyme. That co-infections like Bartonella and Babesia are the most common, right? Bartonella, Babesia. After that, the next co-infection that seems to be common is Mycoplasma. Lots of viruses after that. And after that, it just goes all over the place after that, because you have Rickettsia, right? You have Ehrlichia. Now, Ehrlichia is more common than Rickettsia, but with my son, we had overall 11 infections that crossed the blood-brain barrier. And we had several more in the gut as well. For myself, when I started, one of the I guess supposed side effects, you could say, of being able to treat my son was that I was able to treat myself. All the excuses that us moms make, ladies make overall, because women make a lot of sacrifices. We're always looking after the family. We're always looking after the children. Oh, maybe I'm stressed. Maybe it's the wrong time of the month. But it's very important to maintain our own health. You have one life to live. And I discovered that I had 19 co-infections. And who knows how long back. I mean, that's a very, I do know how long back, but that's, it's a story for another book, I guess. But yeah, but it's very important that mothers look out for themselves as well. Easy thing is, whatever you're doing to treat your child, do it yourself.
Wow. Yeah. Thank you for the advice. Thank you for the advice. Yeah, because as you say, we are under lots of pressure, and it is very likely that we also are infected, but we are not aware of that. Now we have one question coming from the chat. And the question is, where shall we look for co-infections? Urinoculture, nasal swab, PCR, corpus culture. You have mentioned something about that already. I don't know if you want to elaborate.
Sure.
Yeah.
Yes. So there are a couple things available. One is urine culture, and second is blood test. Okay, nasal culture is not for co-infections. Nasal is for MARCoNS and biotoxin illness and what have you. So that's a different topic. But yeah, so blood tests and urine testing. The only labs in Europe I know is Armin labs, and I do not recommend urine testing. Now, DNA connections, all right, urine testing from the US, I don't know where they ship or how far they ship. They used to ship all over the world, but after the pandemic issues, it's been kind of scattered, where they are able to ship. But again, honestly, if you can get blood tests done through Armin Lab, right, TICPLEX Plus, that is the good one to try in Europe itself, and DNA connections. These are the two that I would recommend for European practitioners. I mean, for European clients.
Okay, thank you so much for this, because this is also a common question: how to to make sure that Lyme and co-infections are present. You have mentioned that what is also very interesting, that the Lyme disease and co-infections come also with viruses, and this is amazing how many elements can be in the Lyme disease. So actually, when you treat the Lyme disease, you have to treat viruses at the same time, it seems to me. And we have one of the questions is about Epstein-Barr virus.
Mm-hmm.
Is this something that is also common in the Lyme disease, or you can see this separately as a problem with the kids on the spectrum, or does it come all together in this picture of Lyme disease?
It's both. Okay, children on the spectrum who don't have Lyme disease will also sometimes show very high titers for Epstein-Barr. Now, understand that studies that have been done for autism itself that show that immune system is dysfunctional in children on the spectrum, right? No one has really elaborated a whole lot, and this was what I kind of held on to. Because, why is the immune system compromised? What do you mean? You can't just make a blanket statement saying that, and I was going through research studies because I could see that with Brian, he was fine in the beginning, and then, vaccine injury, I should have known better, but vaccine injury, and then he just slipped away. And I'm like, wait a minute, what do you mean? This is a lifetime, a life sentence for him. There has to be something we can do other than diet, other than sensory. No, there's nothing. I couldn't buy it. ABA therapy, nothing worked. We tried speech therapy, wasn't working. In fact, I could see that he was getting upset with all of these therapies because, his intelligence level was far beyond that. He's like, what the heck are you asking me to do? These silly things. And later on, we realized that without any kind of therapies, he recovered well. Once the brain had a chance to kind of develop, So it is now. Once again, as a mother, I sidetracked, but viruses, yes. So viruses with Lyme disease and without Lyme disease. Now, depending on clinical symptoms, that's where the order of treatment comes into play. Sometimes you may have to treat viruses before you can even start treating Lyme disease, right? So what comes first? Toxins, or is it bacteria, or is it viruses? That will depend on each person. But I will be attempting to explain and make it simpler in my hour-long PowerPoint, which I'll be speaking at Autism One. Yeah, Epstein-Barr is so common. Titers are off the charts now. In your methylation testing, right? Nutrigenomics. Many children show up with like VDR TAC issues, right? So that is, VDR is vitamin D receptor. So everyone looks at, oh my gosh, MTHFR. That's not the only one to look at. The three important ones that I like to look at is MTHFR C677, MTHFR A1298, CBS C699, as well as VDR TAC. Okay, now VDR FOQ is important if there is diabetes in the family. But VDR TAC, vitamin D receptor, there's this whole piece of information out there about nagalase, right? Nagalase enzyme. And, nagalase is what is produced by excessive viruses in the body. It goes and blocks these VDR, it blocks the vitamin D receptors. And if these receptors are already mutated, especially if it is homozygous, meaning, plus, one from each parent. So if these receptors are already mutated, that becomes a very inflammatory and complex situation for the child. So in this case, it becomes important to address the viruses. So I might use the virus blend, of course, but then I might use a couple additional herbals because I know that for this particular child, this becomes extremely important because, VDR blockage by nagalase can lead to all kinds of terrible things like cancer and autoimmune conditions and what have you.
Okay, thank you very much for explaining this link with viruses and nagalase. This is also something that we often hear, but we don't understand all these connections, and about this also genetic testing, because we also wonder which one we should take and which are the most relevant ones, I would say. And I have another question from Dubravka. And I would also like to say to other participants that they can write me a question in the chat, and then I can ask you if they don't want to ask. I will ask Dr. Dashore if they don't want to ask directly. So Dubravka asks which lab test the urine test in the USA, but I didn't understand maybe fully, Dubravka, if you could elaborate a bit more. Which lab does the urine test in the USA? Do you mean Lyme or?
Yes, for Lyme and co-infection.
For Lyme
the
and
doctor
co-infection.
explained about taking diagnosis from the blood and the urine, but she said that urine test in Arvin lab, it's not a good one. So I just wanted to ask which laboratory in the United States is good for that test.
Yes, of course. Hi, Dubravka.
Hi, just a second.
Yeah, sure.
Picture. Okay.
Okay, so it is called as DNA, DNA connections. So connections is spelled with the X. So CONNEXIONS. So DNA connections, Lyme disease testing. Now, also remember that, I've spoken with Dr. Leslie Douglas. She is the director at the lab, and she's wonderful. I really like her. Now, there are different test kits and different instructions for Bionexus clients. So as a courtesy to the group today, I will give you that information as well. So when you order this test kit, if they used to ship, for a $75 fee everywhere, but it probably depend on your country now. So you can certainly ask them, and you can tell them that I referred you, that's fine. But when you collect the urine sample, the lab instructions are good, but they tell you that post-exercise, collect one sample and you're done. But that is for patients who are only looking for Lyme disease, right? That's the only thing. Most of my patients with autism, if you feel that your child may have biotoxin illness, may have had mold exposure, then you have to do 2 collections, okay? What you will do is follow the lab instructions. So you will do exercise and then, collect one sample, but only fill half of the urine cup and put it in the fridge, and then go about the normal routine.
Mm-hmm.
And the next time your child has to go pee, take the very next sample as well, and then you fill up the cup, shake it, and send that. So this is going to be a mix of 2 urine samples, one post-exercise, which, the lab will send you the instructions, but you have to collect the second one if you suspect mold exposure. So this is, immune system explanation, long story, but we are not looking for the first discharge from the immune system post-exercise. We are looking for the second one as well, because when there is Lyme and mold, there is a lot more immune dysfunction than when there is just Lyme. So you have to try and collect the second attempt, because it may take the immune system longer to throw toxins out through the kidneys. Okay, so 2 sample collections.
Okay, thank you.
You're welcome.
Okay, great. I think it would be good now, as you mentioned also mold, to talk a bit about mold exposure.
Okay.
Because this is something also very common in our kids, as I understand. And as I don't know how much time you have, I'm just trying kind of.
Oh, we have, okay, no problem. I have an hour today.
Okay. Okay,
right?
so we
And,
still have some time. Okay.
Yeah, we do, yeah.
Yeah, just to cover, this issue of mold. Is mold exposure very common in autism spectrum disorder? And how would you recommend that we detect it? And are there any kind of specific symptoms for mold, or it just kind of aggravates the other infections, the infections that exist? Like
Okay.
Lyme and co-infections. So if you have mold exposure, is this common, and how do you see the symptoms? Are there any specific symptoms or not? And how to handle just in brief, because we don't have too much time. So many questions, and I know that you already had one podcast only on mold, and we can talk a lot, but maybe just in brief.
Yes, of course. Mold itself can cause a lot of brain inflammation. Mold exposure actually causes brain damage. So between 1 and 7 nuclei in the gray matter can shrink, and between 1 to 3 areas in the white matter can swell up. So, it is quite understandable that it causes a significant amount of brain damage. One of the best examples I like to give again is of Brian. Here, I did not discover about mold. Mind you, I started treatment when he was 18 months old, and not until he was 9 years old did I discover about the mold, because it was very excruciating step-by-step process for us. So we did the mold brain MRI. It's called brain MRI NeuroQuant, not available anywhere else in the world except the US. And we found, when the MRI came, most of you might know, my background training is pediatric neurologist, right? So I'm looking at the MRI, I'm like, take it back, it's a mistake. My son is only 9 years old. They said, no, this is Brian's MRI, because it looked like it was the brain MRI of a 65-year-old with Alzheimer's disease. so many nuclei shrinking, swelling. Oh, what the heck is this? 2.5 years of specific targeted mold treatment. And then the brain MRI went back to normal. Because we had already treated everything else, right? We had done biomedical, we did Lyme, co-infections, what have you, but he was still in a wheelchair. So what are we missing here? There was still pain. Then this is where it exploded. After treating the mold, obviously by this time everything else was treated. That's when language came in. So he was already in 7th grade. And then 8th grade, it just completely took off. Freshman year of high school was absolutely phenomenal. He's doing this biology, US biology Olympiad, he's winning medals. I'm like, it just literally exploded after that. So yes, it's very important to treat mold. Now remember, urinary mycotoxins, urine testing for mold is 1% of what's really going on in the body. That is just what's going on in the gut. Okay, so to assume, but just understand that, if you have some urine mold showing up, that is more of a detox problem than a brain damage problem. Okay, mold causes inflammatory cytokines to rise in the body, and they damage multiple organ systems. Then on top of that, any old Lyme disease and co-infections will come back up. Or if there is mold and Lyme all at once, then Lyme, it's not possible to cure either one without, because they feed each other. Mold causes chronic inflammation, and infections love inflammation, so they can grow more. So this is what happens. And that is why I say that if there is both, it's very important to proceed carefully. Otherwise, parents get frustrated. I'm not seeing any progress. In the beginning, I saw progress. What's going on? So don't start blaming anyone. Don't lose your patience. Just understand that, did you do it correctly?
Okay, well, yeah, this is also a bit shocking how mold can do damage, as you say, brain damage. This is hard to believe somehow, but when you get a bit into this topic, then you start realizing how something that you cannot see and you cannot even imagine that it exists, how it can make such a big damage. To a child.
I'm sorry if I may interrupt. You said correctly, hard to believe, right? But 30,000 brain MRI neuroquants have been researched and studied, and there are 4 research studies published in peer-reviewed journals for a while now that outline the damage that is done from a mold exposure. So that is why, in some, the actual Shoemaker panel blood tests are only available in the US, and now it's becoming available in the UK as well, right, in London. But other than that, urinary mycotoxins, gives you a little bit of an indication that there might be something with which is related to mold, which might be going on, right? So you need to keep that in mind, is that it is safe to assume, if there is obvious mold exposure, that it's a very strong possibility that there is brain damage, especially to a developing brain. I've got parents who spend hundreds of thousands of dollars doing stem cells, doing IVIG, doing all of these aggressive treatments, all I guess because it's hope. And you will see some changes, but you may not see lasting changes. One example is with stem cells. Many parents report, and even if you look at the groups on social media, they will tell you that after stem cells for between anywhere from 2 to 8 months, big broad range. There is crazy hyperactivity, it's impossible to manage the child, etc. So no one has really researched anything. Was the child first treated for mold toxins? Did you investigate all of the medical issues? Did you investigate all of the toxins, infections, right? Environmental issues, genetics, methylation. By the time you investigate and treat all of this, you don't need to spend hundreds of thousands on, invasive. I don't believe in invasive treatments. I don't think that is required. It's poor kids. I mean, making these little bodies go through anesthesia, go through, invasive treatments, go through bone marrow aspirations, whatever. Oh my goodness. I don't think it's required, but do they work? Yes. Many times these invasive treatments will give you a Band-Aid approach. And stem cells, depending on the donor, depending on the state of your body, there are at least 50 to 60 variables, which, what have you addressed prior to these aggressive treatments, invasive treatments? What are you doing after these invasive treatments? So there's so many factors that come into play, and that is what you will see the result from this, and both kinds of parents will post on social media. We did phenomenal. So other parents get hope, but I've been trying for so many years that through my lectures in so many different countries, that please take a scientific approach, educate yourself, be patient. There is no magic pill. There isn't. I've had patients that have done 4 rounds of stem cells, 11 rounds of IVIG, and they're still nowhere. Like minimal improvements, but when you do it correctly, when you do a really good herbal approach, you will see lasting gains.
Thank you so much for this, because this was also one on the list of our questions about these other approaches.
Join us next week for part 2. Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the Bionexus Health Clinic and Bionexus Herbals, on the Bionexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.